Alpha has a little heat.
I feel weird. Is it a mini stroke? No, it's joy.
We have songs. We have buzz.
I've had 3 Negronis.
Did you just whisper Negronis?
I don't know the history of the word.
I was thinking of adding a whoa right before cram it wherever.
My DMs are filthy. I can't even open them up in the train.
So what are you waiting? 5 girls, 5
Tonight on the new reality.
Every single case, every single death, there's someone who we love. These are not just numbers.
On the job and at risk. We've seen worker after worker saying, what do? I have to do this work, but how do I protect myself? The push to make Canadian workplaces safer.
We have to make sure that we're providing the policies and supports that is more than rhetoric.
We have to do this work. We have no choice. The long-term impact of COVID-19 on our blood vessels.
We can zoom right in and look at individual cells and what's changing with those cells.
And the Canadian lab shining light on the issue.
Even in the cases where people have recovered, they could be harboring significant risk factors that they take with them into their future.
Hello and welcome to the new reality. I'm Donna Friesen. While the world works to get the pandemic under control, workplaces are still a driver of infection. We've relied on essential workers for manufacturing, transport, food processing, and so much more, of course. Sick pay remains out of reach for many workers who fear the cut in pay or worse, losing their job altogether. Add to that, riding public transit, working in crowded settings. All of it has made industries, warehouses, and factories a place for the virus to spread. Krista Hesse reports on the calls to keep essential workplaces and their workers safe.
A postal code can tell you a lot about how the pandemic has impacted someone. Just knowing the first 3 digits can likely tell you if they've been able to work from home, had timely access to a vaccine, and their likelihood of getting sick with COVID-19. Certain postal codes, known as hotspots, can be found across the country. Living and working there are essential workers, and workplaces where transmission is a looming fear.
He loves his camera. It's him and his son.
Amanda Young-Colucci's brother, Godfrey Young, was a longtime employee at Canada Post. An immigrant from Hong Kong, he always worked hard to support his family.
He's a very honest person. He loves his family. He loves his parents. Just 2 more years, and then he can finally retire.
Take a break, be with his kids.
That's right, yeah, be with his family, and then not in a million years I would have ever thought that COVID-19 would hit so close, to my family.
In mid-January, Godfrey Young showed up for his night shift at the Canada Post Gateway facility in Mississauga. The sprawling facility is the largest in the country. Thousands of people work here, hundreds at a time in close quarters. The facility was experiencing an active COVID outbreak, and there were close to 280 positive cases. Days after his shift, the 62-year-old tested positive for COVID-19. 6 days later, he died.
Since then, I've been asking that question. What happened? How?
Canada Post has had more than one outbreak during the pandemic at this facility. The company declined Global News' request for an interview and said in a statement that it has implemented rigorous safety measures to keep employees safe and has closely followed advice of public health officials, including distancing and screening of employees. It says it is also conducting mandatory rapid on-site testing at many facilities, including Gateway, offering paid sick leave, and recently held vaccination clinics. Amanda, who's also a city councillor in Markham, says it's not enough.
Essential worker like him have to take that type of risk every day. The question is, who's there to protect them?
More deadly and contagious variants have stricken workplaces in the third wave of the pandemic, as warehouses, manufacturing, and food processing plants continue to be significant drivers of transmission. In Ontario alone, 68 people have died from COVID that they got at work, and more than 25,000 contracted it on the job. But advocates say that number could be even higher because not all cases have been reported.
Every single case, every single death, there's someone who we love, our friends, our neighbors, our brothers, our sisters, our parents, or someone's child. These are not just numbers.
Dina Ladd is the founder and executive director of the Workers' Action Center, an organization that supports workers and advocates for changes to labor laws to improve wages and working conditions.
We've seen worker after worker calling our hotlines, calling us and saying, what do I do? Everyone's lost their job in my family. I have to do this work. But how do I protect myself?
Even before the pandemic started, some workers in Ontario had paid sick days, scheduling rights, and a wage increase taken away.
So that context was very much on our minds when the pandemic started, because we were thinking, oh my goodness, they're forced to go to work and we know it's going to be brutal.
And it's not just Ontario. Canada's labour market has undergone a radical transformation in the last few decades. There has been a massive shift towards precarious work and increasing use of temp agencies and subcontracting, leaving workers with fewer benefits and less job security. A recent study found that 58% of Canadian workers did not have paid sick leave from their employer.
And all of those issues create a very unstable feeling, create a real sense of fear, a real sense that you can't really speak up because your job is on the line. So labour rights are really a provincial responsibility, and they've taken a hands-off approach and said, go ahead. We're not going to regulate, we're not going to intervene.
For the past decade, Hong has been working at an industrial laundry facility, unloading and unpacking bags of dirty linens and garments. He makes less than $15 an hour, and up until recently, had no paid sick days. Global News agreed to hide his identity as he fears reprisal from his employer. On New Year's Day, Hong went to work and, as usual, had lunch with a longtime colleague and friend.
身体状况不是很好，他需要钱，这样的话他只好被迫带病上班。他无形中就是把新冠病毒传染给我和我的同事。
His colleague died in hospital a few weeks later, just 1 month before he was to retire. Hong says the factory requires them to wear a mask while they're working because it's impossible to distance on the line.
但是在休息的时候，就是说没有强调就非得戴口罩，因为吃饭的时候，整个房间就是3-4平方米。 多者就餐的时候要20多人，这个距离，安全距离怎么保证？现在没法保证。
When he returned to work, extreme fatigue and swollen legs made it painful to stand for his 10-hour shift, but he needed the money.
工厂没有把我得新冠肺炎这件事情通报给我的同事。
Months later, Hong says he's still suffering long-haul symptoms of COVID-19 and is too weak to work.
Do you feel this all could have been prevented?
这些事情，我觉得应该可以避免。有的带薪病假可以挽救工人的生命。我以后会不会先生一样，新冠会夺走我的生命？
Hello. Good, how are you?
Dr. Andrew Bazari is an expert in social medicine. He also leads a team of researchers who have been studying hotspots in Toronto and Peel.
One of the things we wanted to do was dive deeper into what has been driving the heat and the unequal exposure of COVID.
They found that 63% of people who live in hotspots are racialized and more likely to be essential workers in manufacturing, utilities, trades, and transport. They're also more likely to be low-income earners.
And what we've really found is that postal code is code language for the structural determinants of health and these health disparities that have long been in place.
Bazari says the data is a wake-up call that essential workers in these neighborhoods need urgent protection at work and vaccine access.
Because if people are going to stand up and say, these people are heroes, which I fully endorse, we have to make sure that we're doing the work and we're providing the policies and supports that it is more than rhetoric.
Not having paid sick leave meant workers often couldn't stay home if they felt unwell. After mounting pressure, Ontario mandated 3 paid sick days, but the policy is temporary.
So, labour laws haven't changed to protect workers, and I think that, when you go to work, you need to feel confident that the laws that are there to protect you are not just words on a paper. But what we've seen is enforcement is not happening.
Many also argue that provincial governments were slow to act and enforce rules. And despite new research suggesting that COVID spreads primarily through airborne transmission, experts say infection control measures do not focus enough on improving ventilation. But it's not just up to governments.
The corn continues along this rinsing platform.
Nature's Path is a family-run organic food manufacturer in Metro Vancouver. These lines run 24